When you're thinking about the settings of the pediatric nurse and where the pediatric nurse is going to be practicing, some places, obviously the acute care setting, hospitals, clinics, physician offices, home health agencies, schools, rehab centers, summer camps, daycare centers, hospices, palliative care. So many, many different places where you will be seeing the pediatric nurse in practice. With communication strategies that are utilized when interviewing parents and children, you need to think about the child across the lifespan. So, with your infant, obviously, infants are mostly nonverbal. They respond to stimuli and physical contact. So, the parents are going to play the key role with our infants. With early childhood, we have egocentric thinkers. Others' experiences don't really matter. Everything is really direct and concrete. So when you're thinking about that and communicating, think about what you're saying to them. If you have to start an IV, don't tell them it's a big stick because they reference that to a stick of a tree. So involving this child and yet relying on the parents for quite a bit of information. Your school age child, they would like explanations and reasons. They have a functional aspect of all procedures. They understand objects and activities. School age children are very concerned with their body image, making sure we protect that. Consider, when you're communicating, always just consider where the child is at developmentally. When you're talking to the adolescents, often reminding them how important confidentiality is, and then remembering that they will fluctuate between the adult thinking and the thinking of the child. Also, the video was presented in class, so recall information presented in the video. And then other things to think about as far as guidelines, observe verbal and nonverbal cues. Include the child, allow them time to gain comfort with you. Keep them at your eye level. Make sure you have an appropriate setting which assures privacy and confidentiality. So always provide as much privacy as possible. Try to limit distractions. Don't forget about your computer privacy. Offer them choices if they exist, but don't give them too many. And make sure that you do have a time limit on your choices. And then just always use a different variety of techniques. So encourage talking, open-ended questions, broad questions, directing the focus, listening, being culturally aware, silence, empathy, anticipatory guidance. So many different things to think about when you are considering communication techniques. As far as components of effective communication, touch is a powerful means of communication, but you always need to consider the cultural aspects of that as well. But with touch, you can use supportive techniques, you can use comfort, it offers reassurance. With physical proximity and environment, keep in mind the child's perspective of the environment. So child-sized furniture, things at the child's level, be at the child's eye level when you are talking to them, establishing trust and maintaining privacy. Listening is essential, so you need to be attentive, offer clarification or reflection when necessary, being empathetic, acknowledge their feelings, and then remember to be impartial when you are listening. Visual communication, eye contact, but always remember it's not acceptable in all cultures. So be conscious of who you are talking to. Consider your tone of voice. The way our words are said can either comfort or scare a child. So when you think about that, how does your tone of voice change when you speak to children versus speaking to adults? Consider your body language, both verbal and nonverbal. And then timing. So if a child's parents have just left and the child is very upset, obviously that's not going to be a good time for a teaching session. So make sure that you consider those things. Tips to enhance communication skills. So what can you do to make things better? Play therapy, storytelling, explanation of procedures and treatments. Open-ended, broad questions. Remember that children understand better than they can talk. Use different methods to present and share different methods, or to present and share different information. Word games, word association, pros and cons, magic, writing. So many different things that you can use to enhance communication with the children. So we need to consider play. Play therapy is really important. Play is the work of the child. So children learn how to maneuver the world through play. Play has very many benefits. As far as motor skills, it allows for practice and repetition. It encourages and promotes muscle development and enhances and stimulates gross and fine motor skills. Intellectually, it helps the child in thinking skills. It fosters cognitive development. With social, it provides a child the opportunity to interact with others. It provides them a time to learn and think about other skills like sharing, being polite, being kind, not fighting. Emotional, it provides children a really great way to work through stress. And moral aspects of play, it's good to reinforce concepts of play so that they understand about following rules. What are the goals of the game? What are the goals of the groups? The playrooms in the hospitals, if you work in a large facility that has a playroom, just remember to make that area separate from the area where procedures are done. So if you're going to be giving IVs or shots, just try to make sure that you're keeping those away from the areas where the children will be playing. And then have safety of toys that are going to be in that area. So the different types of play are listed out up here. We touched on a few briefly. So I would take some time, look these different types of play up. Obviously, solitary means playing alone. We do see this, we see all different types of play throughout all different age groups. We tend to start seeing parallel and associative play with our toddlers and preschoolers. Dramatic play, as the child gets older, we might see dramatic play. And that's when the child acts out experiences, especially if they are fearful of what might happen to them again. So just lots of different ideas to the whole concept of types of play. Next, you need to think about considering the preparation for your child for the physical exam. So basically, everything we've talked about is really related around communication. So when you are preparing your head-to-toe assessment, take a look at box 34-5. It talks about an outline of a pediatric health history. And then you need to be able to recognize expected physical and cognitive findings, psychosocial findings for children at different age groups. And we did talk about some of those major points throughout class. So just make sure that you take a little time to understand how you will be performing the assessment. In closing, just remember to review results with your parents. Let them know what you're finding. Acknowledge if they have any concerns after you've completed your assessment and done your physical assessment. Have lab results back, and then just making sure that you acknowledge if they have any concerns. Let them know that you're here for them, and you will provide support and reinforcement.